Okay, what is the number one absolute worst way to destroy your knee joint? That's what I'm going to talk about in today's video, because I'm a non-surgical orthopedic doc, and what I confront daily with people is that, right? They're doing a lot of things that are degrading their knee. They're maybe getting treatments, as I've talked about in other videos, that are degrading their knee, like NSAID medications or repeated corticosteroid injections. But the number one worst way to destroy your knee joint is simply to wait, to ignore the problem. Because like anything, we want to capture the problem early, not late. If we can capture your knee joint when it's a grade 1, not a grade 4, we're going to have a far better chance of turning that situation around for you. So as the years go by and the months go by and then turn into years, we see a lot of people that slip down this hill through those grades of change, and then it's hard to turn that thing around, where the only outcome waiting for them at the bottom of that hill is typically surgery. So as a non-surgical orthopedic doc, I'm entitled to give people the options early in the process. I want to help them look at those options early in the process, because then we can keep them hopefully from that outcome that, look, very transformational for people that need it, but oftentimes we don't need it if we intervene early. So let's look at the grades of arthritis here. Let's talk about where people start to wait and where they shouldn't. So if we see the grades here, 1 through 4, that first one says minimum disruption of the cartilage, but there's already 10% cartilage loss. So that's considered grade 1. Now I'm going to give you a startling statistic that I read in an article that said, look, by the time we can appreciate grade 1, the problem may already have been there for as much as 10 years, maybe longer. I'll say that again. By the time we can see a grade 1 change on x-ray, the chemical process that's been degrading your knee has maybe been there for a decade already. So that's the achy pain that you kind of feel but kind of ignore. It comes on, goes away. Maybe it only shows up after heavier exercise or activity, but that could mean you're in a preclinical grade 1 or already a grade 1. But if somebody's a 2 or a 3, man, at that point, we really need to intercept the problem before they get over to a grade 4 situation, which we start to see complete joint obliteration of that space. Maybe their knee starts to angle, they lose range of motion. At that point, most patients are in a significant amount of pain, and the conventional option that's given to them most often is joint replacement. So again, if we look at these knees on screen, we see some really bad end-stage knees. The goal is, number 1, don't wait, don't get to this stage, because there's less options there. You know, I saw a gentleman this week that he's there, and the best option for him is joint replacement. And that's what he's going to get with the best person he can. And look, 9 out of 10 people are really happy with the outcome of these surgeries. It's transformational. There's nothing like that where we can give somebody a completely new joint back and have them walking around on it day 1, day 2, and in a matter of months, almost like a new knee, right? Now, if people are in those other grades, they may not be at that point where they need it. But if they wait long enough, they will be. So if you're grade 1, if you're grade 2, if you're grade 3, man, this is where we want to intercept that problem. So if you've already seen somebody, you know what your grade is, then again, I want to move you to action on this to say, hey, how can you look at finding somebody to do other treatments before this thing is down the hill towards that grade 4? Because the way I look at things with my patient is this concept of longevity, which I borrow from a lot of people in the space, but I'm going to apply it to joints here. There's a traditional way to look at longevity, which is just kind of how long you live. There's a different way to look at it, which is how well you live and what are the experiences like during that time you live, and how can we extend this back into this with good quality years, right? How do we get somebody more years at the other end rather than less? Or how do we not have the dwindle of these decades at their end of their life? So when I'm intercepting people in middle age, that's what we're trying to do with their joints. Can we give them decades of better joints along with their total health so that they can live out farther, longer and better and healthier and do the things they want to keep doing? So again, this concept of longevity for me isn't about just how many years you live, it's how well you live. And the number one absolute worst way to wreck your knee joint is to continue to just sit on it and wait, because it will go downhill. It's not linear, it's not perfectly correlated with age. Not every 60-year-old has mild arthritis and moderate in their 70s and severe in their 80s, but many cases will progress. And we have the ability to stop that progression. We have the ability to shut off that pain and restore a healthier joint for people to function better the way they want to. So we can take that decade, we can stretch it a little bit. We can give people what is called maybe a bonus decade rather than that marginal decade. You know, some people watching this aren't that old, but you should be thinking about it already. I'm in my 40s, I'm thinking about that. How do I preserve my joints now for the future? What can I be doing to intervene and intercept this problem and not have it get over there where I'm in a no option category and the only thing waiting for me is surgery? So is it possible, you know, is the question. Can we do these treatments? Can we really shut off pain? Can we intercept this point, stall it out, and slow down that progression? And I would say emphatically yes, because that's what I've done in my practice for over a decade with thousands of patients that stopped waiting and took that action and got moving. And so this is another little testimonial from Sandy, and Sandy talked about this. She was able to get this treatment and for the first time train hard enough, heavy enough, as she says, to finally hike to the bottom of the Grand Canyon and back with no pain after we treated her. And Bob here, in this review that he left for me, I think even more importantly than an outcome, he talks about these type of treatments don't work for everybody. And I tell my patients the same. We have to qualify you to know if this treatment can work. And the first way to understand that is to see you as a patient and review your imaging and look at the situation and see during the consultation if it's really a suitable treatment for this, or if you're at that point where some people end up that they've waited too long and the best outcome or the best treatment they can get for the best outcome is really surgical intervention. So if you're looking for a different path, if you're looking to explore things in that middle space, you could be a grade 1, 2, or 3, maybe not a 4. Even if for some of those 4s we have a lot of success. But think about this. The number one worst thing you can do if you have I picked on knee, but it could be your hip, it could be your shoulder, is sit there and wait. So see a qualified doc, dig into your case today, figure out what grade it's at, what treatment options you have available to you, because the earlier you intervene, the more you can give your joint that success you want and that longevity you want from it. So, and it's got to be a process. So I'll leave you with this. The person who loves the walk will always walk further than the person who loves getting to the destination. I want to get people to the destination. We want to get them better faster. But if we think about adopting this way of treating our body and taking care of it, where we are thinking about the future, we are thinking about the longevity of our body, this is what we shape for patients in my practice every day, is intercepting that problem that brings them in the door, but teaching them this pathway that they can go use to extend the longevity of these treatments, but really extend the longevity of their whole health. So we call our system here the path, where we can prepare your body. Sometimes you got to prepare your headspace, and some patients, hey, they've been through a lot of frustrating things. I've been through a lot of frustrating treatments that haven't worked. But if we can activate these systems in the body, we have these innate pathways in our body that can be reactivated to help you heal. And if we can target it with the right treatment, we can bring people over here where that tissue can actually heal, and people get back to those things that they love doing, as you saw in those couple of stories I shared. So if that's you, and you've watched this video and it's connected with you, where a space you're sitting with a problem that maybe you haven't gotten all the answers, maybe you haven't had a great diagnostic workup to figure out what you do have. Maybe you've never seen somebody and gotten x-rays or an MRI to figure out the problem. I mean, that really is the first step. See a qualified doc, get the workup you need. And the way we do that in my practice is, hey, if we can help you in any way, first, hey, like what we're talking about here in the video, subscribe to our channel if you want to get more information about these kind of treatments and what you can do to self-treat on your own, even if you don't see us. Drop a comment below. We're happy to answer those, as many as we can, myself, my team. And then finally, hey, if you want to look at these treatments at a serious level, get on a discovery call with somebody on my team. So in the notes below, there'll be a link. You can click that link and it'll take you over to a form. And that's what my team does day in, day out for patients, not just here in Tucson where I practice, but people come to us from all over the country to get treatment. And you can fill out that form. We can dig into your case from a distance, get the nuts and bolts of it, and see if we can be a help to you, because that's all we want to be, is a help to you. So hopefully this video helped you in some way today, and I'll see you on a future video.